Realizing the potential of Northeast for becoming a healthcare hub for Southeast Asia, Union Minister of State for Home Affairs Kiren Rijiju flagged off the new ambulance service in the city of Guwahati for the patients of Arunachal Pradesh who usually visit Shillong for medical treatment. A report.
Comprising of abundant natural resources, India's northeast region is developing fast in various sectors, and health sector remains a major area of development. It has immense potentialities to become a healthcare hub for Southeast Asia countries. So far, various health schemes, services, medical colleges, hospitals, etc. has been introduced in the states pertaining to the need of the people in the region. Union Minister of State for Home Affairs Kiren Rijiju recently flagged off a new ambulance service in Assam's Guwahati city, especially adhering to the need of the patients from Arunachal Pradesh who usually undergoes medical treatment in Shillong. The ambulance was donated by Hindustan Private Limited following a request from the Arunachal Students' Union, Shillong.
Guwahati itself is already a medical hub. There are many good hospitals in Guwahati. I have visited some of the hospitals while meeting the patients, and I've interacted with the doctors here, the management of the hospital. They are very committed. The dedication of the management and the doctors are very inspiring. And I always feel that I should do something for the medical fraternity, as well as for the convenience of the patients and their relatives.
Stressing on the need to improve the medical standard in the region, Rijiju said favorable policies, support from the government, proactive support from the private sectors, etc. is a must. The region is progressing well in terms of healthcare, but more development are on the pipelines, like introduction of ambulances, advanced medical equipments which will work as a great care for the local people who are not financially strong enough to go out to other cities. Emphasizing on public and private contribution in developing medical infrastructure, Rijiju said, without development of medical facilities, society cannot develop.
Few years back, we used to think that when will Northeast start developing? But now we are seeing it. And from the government side, in last 3 years, the way we have laid the foundation, the Prime Minister has absolute clarity in his mind that without the development of the Northeast, we cannot claim that India is developing.
Focusing on the need to improve health scenario of the region, the minister further appealed to the corporates to come forward and open medical facilities in the region.